Around half of the world's population is unable to benefit from basic health services. In many rural areas, poor roads, a lack of transportation and transport costs can mean a sick child may not reach a health facility in time to receive treatment. But poor access is not only about location. Sometimes it is about the cost of treatment. It is estimated that 800 million people spend 10% or more of household income on paying for healthcare. For almost 100 million, that's enough to push them into extreme poverty. The number of child deaths from preventable diseases worldwide is falling, although very slowly in some countries, particularly in sub-Saharan Africa. Every year, 5.6 million children are still dying before the age of 5, with malaria, pneumonia and diarrhea accounting for almost 30% of these deaths, and neonatal conditions for about half. Primary health care needs to be available in the heart of communities, serving the most vulnerable, young children, newborns, pregnant women and the chronically ill. This is the only way universal health coverage and many of the Sustainable Development Goals will be achieved. Integrated Community Case Management, or iCCM, forms a vital part of this process, delivering life-saving treatment at community level for these and other childhood diseases. iCCM-trained community health workers, who are provided with medicines and equipment, can identify and correctly treat most uncomplicated cases of malaria, pneumonia and diarrhea, and only refer those that need a higher level of care. With a considerable amount of case management taking place at the community level, iCCM can also help reduce the load on overburdened health systems and improve their efficiency, with better use of both financial resources and commodities. Ownership at the community level is essential. But to ensure they deliver a high-quality service, community health workers require training and tools, as well as supervision. They must link with and be an extension of the formal health structure. They are uniquely placed to capture health data, which can be reported directly into the health system to strengthen disease surveillance and planning and budgeting. Technology also has a key role to play to strengthen many aspects of iCCM, providing community health workers with reporting mechanisms and supporting quality of care, supply chain management and health promotion. iCCM is now being expanded to fill other gaps in primary healthcare, such as maternal and newborn care, family planning and HIV/AIDS. Community health workers are also used to support mass net distributions and drug administrations for neglected tropical diseases. Undernutrition is another crucial health gap and contributes to about 45% of child deaths, making children more vulnerable to diseases and less able to respond to treatment. Screening for undernutrition can also be provided through iCCM, and in some remote areas the feeding programs can be brought to the community, providing children with ready-to-use food. Effective surveillance must be an integral part of a national response to malaria, both for early detection and to respond to disease outbreaks. This is essential to support malaria elimination. In Myanmar, we are introducing iCCM to ensure surveillance continues at the community level, to find every last case of malaria. Social behaviour change programs, led or supported by community health workers, also help improve good health practices and early access to treatment for sick children. This helps save lives and encourages appropriate use of drugs, which is crucial in the fight against rising antimicrobial resistance. iCCM implementation needs to be country-led and owned, and backed with strong political and financial commitment as well as broad community support. Together with the World Health Organization, UNICEF and other international agencies, we call on national governments to promote policies and programs that focus on the integration of child health and malaria. These should have strong community-based health components, recognizing the vital role of iCCM in reaching the most vulnerable. The international donor community must also continue to support the scale-up of iCCM as a viable and sustainable approach that will strengthen health systems and fill gaps in health provision. If we are to achieve universal health coverage and the Sustainable Development Goals, we must do whatever is necessary to bring primary healthcare to underserved communities.